What's going on, everybody? It's the Mobility Caddy here, and today we're talking about repetitive use considerations for the pelvic mass of the golfer. So as a right-handed player, we are moving this way, to the left. Internal hip range of motion, external hip range of motion. And over time, with repetitive use, the ability for us to turn the opposite way, which would be internal hip range of motion and external hip range of motion to load our backswing, is going to be reduced. So what we have to do is we have to target the tissues that are resisting and or limiting our ability to turn the opposite way. There are two techniques and there are two tools that I'm going to use today to show you how to restore that range of motion that we have lost as a result of repetitive use. So for the right hip, the deep hip rotators, I'm going to use our green RAD round. I'm going to have a seat on the floor. I'm going to find a comfortable spot. I've got a mat here to dampen some of the density of the tool, but if you want the full effect, just go ahead and place that right on the gym floor or a hardwood floor. I'm going to target the little hip pocket right here. I'm going to lean back with my arms. I'm going to have a seat. I'm on the deep hip rotators here, and for 10 breaths, in and out on that location, I'm going to pin and hold and desensitize the area, okay? And what this does is it helps squeeze out some of those inflammatory molecules and decrease the perception of pain and desensitize the area. Once I feel that that is reduced, I'm going to start to take the tissues in the direction they don't want to go. So I've got the external hip rotators pinned here, and I'm going to rotate in the direction they don't want to go, which is internal hip range motion. So I'm internally rotating the head of the femur to help restore that range of motion. And I'm going to go through 10 to 12 reps, or until I feel like I've got 75% increase in ability. Okay? So that is restoring internal hip range of motion. Let's go to the other side and get external hip range of motion. I enjoy the RAD Atom for this one. It's really good for unshackling the adductors here. So I'm going to prop it up on my RAD block. I'm going to get into these tissues right here. Now it's going to be sensitive for most people. So you can dampen that with a mat underneath the block there. And what I'm going to do here is pin and hold again. 10 breaths in and out, desensitizing the area to pain, squeezing out some of those inflammatory molecules. And once I feel like I've gotten that under control, and I can start to move and shear across the fibers, I'm going to start to straighten the leg, back and forth. Relocate, and try again. Now there's more tissue involved than just the adductors when it comes to external hip range of motion, so I'm going to flip over to the front side of the hip. And I'm going to pin and hold the front of the hip here. 10 breaths. Let's say that I've done 10. And now I'm going to start to take the tissues in the direction they don't want to go. So I'm going to bend my knee and produce external hip range of motion. You can see that I'm off to the side here. I don't have much pressure. If I want more pressure, I can get right on top of that tool and rotate. And that is our intervention with the RAD tool. And now we're going to get into our active range of motion drill. And we want to make sure that we consider all three planes of motion. As golfers, we live in the transverse plane. So what we're going to do now is we're going to go through the sagittal plane, frontal plane, and also transverse plane to ensure that we get all three planes of motion and all degrees of freedom in that joint. I'm going to grab the dorsal side of my foot. As you can see, I'm kneeling on a RAD block. You can choose any block, but this one here is the best for kneeling. Nice and tall. And we're going to shift our pelvis forward, putting this tissue on stretch or putting tension in this tissue right here. Breath in and out. And back it off. Let's try that again. Big breath in. And relax. Now we're going approximately 10 reps or until we feel like we've got 75% increase in ability or increase in range. All right, for the frontal plane on the left hip here, the left adductor, I'm going to get into a semi-quadruped position here, so not full quadruped, but almost like a hockey goalie save, okay? And what I'm looking for here is to maintain a neutral spine. I've got my hip, knee, calf, and ankle in alignment. Big breath in. Exhale. Rock back. Tissue here is being put on stress. Okay, there's some tension here. Back it off. Big breath in. Exhale. Rock it back. Again, guideline is 10 reps or 75% reduction in tension, or you're seeing 75% improvement in how much those tissues glide. Okay guys, last but not least is our transverse plane for both the left hip and the right hip. We're more or less focusing on this left hip right now. Staying tall, we are going to drop the knee down and back to center. And back to center. For those of you that are familiar with the FRC or functional range conditioning, they call these bear sits. We're internally and externally rotating the hip back and forth. And that would be our transverse plane active mobility drill. We've gone through a RAD tool intervention on the affected areas of the body. We followed that up with an active mobility drill of the affected areas of the body. So bringing back all that sensory-rich information to our nervous system to let it know that we have those ranges of motion to use now. We're going to follow that up with our fifth principle, which is stabilizing or connecting that area or those areas that we worked on to ensure that the brain knows that it's safe to use those ranges of motion now. So this is our first drill here. We're going to exercise the left hip joint in the sagittal plane. And there are many exercises we can do, but this one here, the glute bridge, is one of my favorites. So we're going to pull our opposing knee to our chest here, and that locks out the lumbar spine, creates a pelvic lock so we do not extend through the lower back. We're going to bring this heel directly underneath our knee. Take a big breath in. Exhale. Drive the pelvis up towards the ceiling, hips off the floor. And relax. Big breath in. Exhale. And relax. You might have to play around with foot placement here. If you do get a hamstring cramp, move that foot around until you feel as though that left glute is working. And that is sagittal plane hip stability. All right, guys, here is the frontal plane of stabilizing this left hip. We're going to get into a side bridge. So what's important here is that I've got a neutral pelvis. Abs are tight. Glutes are tight. Hand on the hip. Pack the shoulder and elongate the neck. And we want to try and keep the spine in a nice straight line or neutral as much as possible. And we're going to push off of the left knee and shin. Breath in, breath out, back down. Common mistakes here, people hinge too much in the pelvis. Make sure we're fully extended. Again, pack the shoulder, lengthen the neck. Big breath in. And back down. And that's frontal plane hip stability. All right, guys, the last phase is the transverse phase, okay? Connect phase, we want to get as much sensory-rich information into this left hip as possible. We're going to use a clock lateral lunge drill to do that, okay? So standing up nice and tall, we're going to load the left hip, come back to center. Come out on a 45. Load the left hip, come back to center. Straight back. Load the left hip, come back to center. 45. Left hip, and then out lateral. That's going to give a ton of sensory-rich information to that left hip. Decelerating and accelerating, coming back to that center, and getting you ready to go ahead and tee it up. All right, guys, let's wrap this whole thing up. Let's bring it all together. Let's put a bow on this and package it up. What we did is we went through 3 different phases of our RAD mobility continuum. The secret sauce is assess first, intervene with the RAD tool, go through an active range of motion drill or an active mobility drill, and then connect, okay? So we can use what we've done, use that range of motion that we've just restored, and put it into the real world. Check this one out. Right-handed golfer, repetitive use, internal range of motion, external range of motion. What does that do? Over time, it limits our ability to access internal right hip range of motion, external left hip range of motion, to get into our backswing to load up and actually create some power. So we went through that entire continuum to restore those ranges of motion. All you have to do now is execute the 6th phase of the RAD mobility continuum, which is integrate, grab your club, head to the range, and go hit some balls.
For more information, visit radroller.com. For more video tutorials, check out our YouTube page at youtube.com/radroller.
I'm losing it, Steve. Losing it. Okay, here we go.